Good afternoon, everyone. Thank you for joining our education and training today. This session is being recorded and will be posted on our YouTube channel for the Family Caregiver Support Program within a few days. So you have access to watch it from there as well. Today's training, I will be discussing memory loss, understanding memory loss. We'll go ahead and get started. Just want to quickly introduce the Family Caregiver Support Team. I am, again, Olga Yamawaki, Case Manager. We have Michelle Maguire and Valerie Moreno as well. A little overview of what I will be discussing today. It's differences between mild forgetfulness and more serious memory problems. Serious memory problems, some of the causes and treatments, help for serious memory problems, what you need to know, where you can get more information and assistance, and words to know doesn't really apply. Sorry, forgot to take that out. So differences between mild forgetfulness and more serious memory problems. We've all forgotten names, where we put our keys, or if we lock the front door sometimes. It's normal to forget things once in a while. However, forgetting, how to make change, how to use the telephone, or find your way home may be signs of a more serious memory problem. So what is mild forgetfulness? That could be as we get older, it's true that some of us get more forgetful as we age. It may take longer to learn new things, new tasks, or remember certain words, or even find our glasses. These changes are often signs of mild forgetfulness and not serious memory problems. For most. If you see your doctor if you are worried about your forgetfulness, or if you think you're having more memory problems than you normally would. Make sure you let them know about your concerns, and then just be sure to keep up with your follow-up appointments to check if for any changes that may have occurred. Some ways to help your memory, learning a new skill. It keeps you active. It keeps you active and your brain functioning. Spending time with friends and family. This could be playing cards, playing games, crossword puzzles, even telling family stories. Kind of keeping up that the memory again and the brain functioning. Use memory tools. This could be calendars, big calendars, to keep track of appointments or any important dates. A to-do list is also helpful, and notes to yourself. Things that you need to get done. Just make sure you write down and put a note. I know for myself, I always have to write things down or I will forget. So I have little sticky notes laying around, here and there, just so it helps me remember stuff that I need to do because I know, I will forget if it's not written down. I also have my phone calendar, and I also keep a hard copy calendar. So for me, writing things down, it helps, stick it in my brain more. When I write it down, it's so more helpful. It's so much helpful for me on a personal level. Also, put your wallet, your purse, keys, any important, your glasses in the same place, every day. So you know where they are and you don't have to be looking around the house for them or in the car. Get lots of rest as well. Exercise and eat well. That would help with memory, and get help if you feel depressed for weeks at a time. That it might be some of the memory problems may be because of depression. So what is a serious memory problem? This serious memory problems make it hard to do everyday things. For example, you may find it hard to drive, shop, or even talk with a friend. Signs of serious memory problems may include asking the same question over and over again, getting lost in places you know well, even getting lost, if you go out for a walk and you can't find your way back home, that should be a sign to look out for. Not being able to follow directions, becoming more confused about time, people, and places, not taking care of yourself. This could be, eating poorly, not bathing, and not being safe in the house. Again, see your doctor if you are having any of these problems listed here. It's important to find out what might be causing some of the more serious problems. And once you know the cause, you may be able to get the right treatment for it. So always discuss with your doctor any changes that you may be experiencing, either for yourself or for your loved one, whichever may be the case. Some more serious memory problems, some of the causes and treatments. Many things can cause serious memory problems, such as blood clots, depression, and Alzheimer's disease. Some of this, certain medical conditions can also cause serious memory problems. This problem should go away once you get treatment. Some medical conditions that may cause memory problems are a bad reaction to certain medications. If you're on medications for some type of illness, depression, not eating enough healthy foods or too few vitamins and minerals in your body. Also drinking too much alcohol, blood clots or brain tumor, head injury. This could be from a concussion or from a fall or an accident. So always, be careful if you do have, if you do suffer a fall and hit your head, just make sure seek medical attention if you do feel like that might be a cause. Thyroid problems, kidney and liver problems can also have some impact on your memory. So these medical conditions are serious, so make sure you see your doctor for possible treatments. And then that way you can seek the assistance that you need. Emotional problems can also, some emotional problems in older adults can also cause serious memory problems. Feeling sad, lonely, worried, or bored can cause you to be confused or forgetful. Gotta remember, you have to keep your brain active, to be able to keep it, what am I trying to say? Just being active, like the brain is your muscle. So, keeping the brain active, it's exercising the brain and being able to recall more stuff and keep forgetting less. So see a doctor or a counselor. You may need to see one of these specialists. If you are feeling, if you are having memory problems or feelings that last for more than 2 weeks. Once you get help, your memory problems should start to get better. If it's because of depression or some emotional problems, of course. Being active also, again, spending time with friends and family, recalling stories, telling stories, it's just playing games, again, exercising your brain, and learning new skills can help you feel better and, improve your memory as well. As some people grow older, they may have more memory problems than other people their own age. This condition is called mild cognitive impairment, or MCI. People with MCI can take care of themselves and and can do their normal activities. And some of the memory problems that MCI patients may include losing things often, forgetting to go to events or appointments. This could be doctor's appointments, birthdays, family, important family events. Having more trouble coming up with words than other people of their same age. Your doctor can do some tests, such as thinking, memory, and language tests to see if you have mild cognitive impairments. He or she may suggest that you see a specialist for more additional tests if needed. Because mild cognitive impairments, it can be an early sign of Alzheimer's disease as well. And there is no proven treatment for mild cognitive impairment. So make sure you just keep an eye on your symptoms, see your doctor or your specialist every 6 to 12 months and kind of monitor where your symptoms are and if they are progressing. Alzheimer's disease causes serious memory problems. The signs of Alzheimer's disease can begin slowly, but can get worse over time as the disease progresses. This is because changes in your brain cause large number of brain cells to die. It may look like a simple forgetfulness at first, but over time, people with Alzheimer's disease have trouble thinking clearly. They find it hard to do everyday things like shopping, driving, cooking. As the illness again progresses, people with Alzheimer's disease may need someone to take care of their needs at home or in a nursing home if that's where the person resides. These needs may include feeding, bathing, and dressing. There is no cure for Alzheimer's disease. Certain medications can help slow down or can help slow some of the symptoms down, or such as memory loss for a time, but some of the medicines also for Alzheimer's can have side effects. So, and they may not work for everyone. So just make sure you do speak to your physician and get advice on if you are put on medication for Alzheimer's. For that. Also, vascular dementia. Many people have never heard of vascular dementia. Like Alzheimer's disease, it's a medical condition that causes serious memory problems. But unlike Alzheimer's disease, signs of vascular dementia may appear suddenly. And this is because the memory loss and confusion are caused by changes in the blood supply to the brain, which is often caused after a stroke. If the stroke stop, then you should be able to get better, of course, with help from your physician, or stay the same for a long time. But if you do suffer from more strokes, you may get worse, and your memory impairments may also get worse. Some of the treatments for vascular dementia, you can take steps to reduce, having strokes. So take control of your high blood pressure. Make sure if you do have high blood pressure, make sure you are being treated for it. Take care of your diabetes also, and smoking. Stop smoking can also help reduce the chances of you having a stroke. So try to get your blood pressure checked every time you see your doctor, and make sure that's monitored and stable. Some help for serious memory problems. Again, see your doctor if you are seeing some changes and you are worried that it may not be a normal, getting old, or signs of just getting old. If your doctor thinks that your memory problems are serious, you may need to have a couple of, you need to have a complete health checkup with the doctor. Doctor will review your medicines because some of the medication may also be a side effect. So some of those memory problems may be due to some of the side effects of the medication and not necessarily because you are having more serious problems. Doctor will review your medicines. They may test your blood and urine. You may also need to take tests that check your memory, problem solving and skills, counting and language skills. And if your doctor thinks it's a more serious problem, they may suggest also to do a brain scan. And then the scans can show normal or problem areas in the brain if you are having any brain issues. So what can family member do to help? If your family member or friend or even yourself are experiencing serious memory problems, you can get help for that person and they can live a normal life, as much as possible. You can help the person stay active, go to places and keep up with everyday routines. You can remind the person of things such as the time of day, where he or she lives, and what is happening at home or in the world. Just kind of keep them, engaged and updated on what's going on. You can also help the person remember to take their medicines and and doctor visits. Some family members use big calendars to highlight, again, important dates and events. A list of plans for each day. You can make a list for that individual. It's like, this is what you're going to be doing today. Notes about safety in the home, whether that could be, the stove, turning on the stove, maybe not using some of those items if the memory issues are more severe. Written directions for using common household items, how to use the microwave, how to make coffee. Most people with the Alzheimer's disease can still read, so they're still able to follow directions. And again, if you feel like they're having more serious problems and need more constant supervision, they just, kind of arrange for that. And again, be mindful of the home safety protocols for someone with more severe memory problems. So what you need to know, always, there's a difference between normal forgetfulness as we age with more serious memory problems. Like I mentioned, with Alzheimer's, vascular disease, vascular dementia disease, or mild cognitive impairment. So just kind of, keep track of the symptoms. And if you are having issues, talk to your doctor just to rule out any of those more serious problems, as opposed to just the normal forgetfulness that we all experience with age. It's important to understand the causes of memory problems and how they can be treated. Again, some of the causes can be due to side effects of medication. So if that is the problem, once that gets resolved, again, your memory issues should go back, or you should go back to your normal old self. And you can get help for mild and serious memory problems. So again, seek help, whether it's your doctor or a friend, family member. It's important to find out what is causing your memory problems. That way they can take action and resolve the issues. You can get more information from the Alzheimer's Association. There's also clinical trials that you can participate in as well. And some of the clinical trials, from what I read, you don't necessarily have to have memory problems to participate in them. But again, they are for people with memory issues. So you might be able to participate in some of those trials. The National Institute of Health has some of the clinical trials as well as Alzheimer's Association. So if you are experiencing any issues and you do want to participate in some of this information, these are some of the links that you can go into. And Alzheimer's Association also has a lot of resources for family and individuals with memory issues. So that's a good resource to look into. And I think that is all I have for today. Thank you for joining. And if anybody has any questions or comments, go ahead and open up the floor.
Well, that was really interesting because I know that memory changes with age, you know, but there is definitely a distinction between that normal, I guess, and like more a serious problem. So that was great to have that blown out like that. I was wondering if either one of you know or have seen, if there's really any help given by those, you know, you can join like a mental gym. I forget the name of them, but they give you like a mental workout where you do puzzles and like work out your brain and stuff. I forget the name of it, but there was a couple companies that were offering this. It was kind of like supposedly to keep your brain and your memory working and keep it strong. Have you guys seen those, and have you heard anything about their efficacy, if they actually work or not?
No, I haven't heard of anything like that, Michelle, but it's interesting now that you bring it up. So maybe we need to look more into that and research it.
Yeah, I have heard of a few. I can't think of the name right now, but there's one place where they'll send out even like kits for the individual, like you mentioned, puzzles and like all this, you know, things to keep you engaged and exercise your brain.
Mm-hmm.
I think it helps because if, like I mentioned, if you're bored and the way I see it, it's like your brain's not actively, if you're not doing anything and you're bored and you're depressed, I feel like your brain kind of dies a little.
Yeah.
That way. So just keeping your brain active. And I know a lot of people that like to do crossword puzzles, or they'll do like all this just to keep that brain, you know, exercising. Even learning new skills, like I mentioned, you know, it keeps you thinking and like, you know.
So like learning a new game or listening to different types of music and stuff like that, just stimulating the brain. Is that what you're talking about?
Yeah. Learning a new language, like things like that exercise and kind of keep your brain, I guess, active.
And also prevent you then from, like you were saying, getting down. And so it prevents you from the negative and kind of facilitates the positive. That's kind of cool.
Yeah, that's why they advise, you know, keeping active and being around other people, whether that's family or friends. I know it's kind of hard right now with all this, you know, COVID and everybody's else isolating. Yeah, that interaction with other people, it keeps you active and it keeps you, you know, thinking and on your feet, kind of, you know.
Yeah.
Calling stories, or, you know, or telling stories of you know, your life. I think that helps a lot.
Thanks. Well, that was a really good presentation.
Yeah, it was a really good presentation. Olga, I have a question for you. Was there any other types of dementias? I know you mentioned the vascular. Was there any other types?
There's a lot of types, but I didn't go into details into all of them. This was just like the I guess the most common ones.
Okay.
It's like a lot of types of dementia, but these are the most common ones, like the Alzheimer's, the vascular dementia, and then the mild cognitive impairments.
Yeah.
Maybe you could do a whole session on types of dementia.
Yeah, that would be interesting. Olga, I was actually going to tell you that I've actually read an article that, you know, in order to exercise your brain after work, they recommend each time you drive home back from work to take a different route, just to keep your brain like sharper and learning new like, you know, routes and stuff.
Yeah, I've heard that because sometimes, I don't know if that's happened to you, but it's happened to me. Like I'm driving home and next thing I know, I'm home, but I don't know how I even got there.
Oh yeah.
Yeah.
You're like an autopilot.
Yeah.
So I have heard that because, you know, you are using a new route, so you're more aware, you're thinking.
Yeah.
So we're in the moment as opposed to just like autopilot.
Yeah, it makes you more sharper and I guess focused.
Yeah, I have heard that. Yeah.
I'm going to try that.
Yeah, it's good because, you know, you learn, you know, different ways to get home and it just keeps your mind sharp and exercising.
Yeah, it prevents you from zoning out.
Mm-hmm. Yep.
Yeah. Okay. Did you want me to stop the recording?
Yeah, you can stop. Right.